Oh, yay! Live these seminars, so if you ever can't make it, please join us on Facebook Live. We also have a YouTube channel where you can view previous seminars. But I will be holding this microphone, even though there's no stereos in here. It's for the audio on Facebook Live, just so you know.
Oh, is my mic on? Yeah, okay. All right.
We're live?
All right.
Okay, everybody. I wanted to thank you so much for coming out tonight to our August installment of the Animal Care Center's You Care series. We're really excited that you can join us tonight as a super hot topic, something that pet owners and caretakers are talking about alike in our community. And there is so much information that we feel like pet owners need to be aware of that you're not. So you're tuning into a really great seminar tonight. Dr. Lindsay is going to be presenting our topics. We're very lucky to have her. So just thank you again for joining us. If you have any ideas for future topics, feel free to submit those to our email at wecare@utahanimalcare.com. And I'm just going to pass the time over to you to educate us. Thanks,
Perfect.
Dr. Lindsay.
Wonderful. All right, thank you everyone for coming. So, oh no, it hates it. Well, I'll do this way. Okay, have to do it the old-fashioned way. All right, so my name is Dr. Lindsay. I am the medical director and an associate veterinarian at the Animal Care Center in Bountiful, Utah. Just a little bit about me. So I graduated from Purdue University in 2012, and then after I graduated from vet school, decided it'd be a really good idea to put on some combat boots and join the veterinary corps. So the first 4.5 years of my veterinary career, I was actually an Army veterinarian, taking care of military working dogs around the world. Kind of just a little bit about me outside of veterinary medicine. I love to travel, love to be very active. I like to run and hike and do all sorts of those types of things. This is me during our last little trip. We went to Iceland, and I, of course, had to take a picture with a pony. And then this is one of the biggest reasons that I really care about a lot of these hot topics and things. So this is my dude. This is Gibson. He's a 10-year-old shepherd mix that I got when I was a second-year veterinary student, and he kind of taught me how to be a veterinarian from the very get-go. So today, what are we going to be talking about? So this is a big hot topic issue, and actually one of the reasons why I'm talking about this today is one of the members of our audience. So we have one of the sweetest patients. Her name, hi. Down is forward. Okay. So one of my patients, her name is Indy. She came in because she said, you know, her mom said, she's just not acting right. This dog is crazy ball driven, and she was not, you know, having her normal exercise tolerance where she would just go, go, go forever, and she was panting a little bit harder than she normally did. So we started talking and things, and we talked a little bit about her food, and she had been on a grain-free diet. Really sensitive tummy, and that's what settled her stomach when she was a young dog. So we actually sent her to visit with one of our local cardiologists, and she was diagnosed with this disease. Fortunately, she's very lucky. Her mom caught this disease in the very early stages, and she's doing wonderfully. But it's very scary, and it's real. Since some of this information about grain-free diets and cardiomyopathy have come out, I've actually diagnosed personally 3 cases within the last year, and that's a lot. And that's one of the reasons why I wanted to talk a little bit about this topic today, because it's really scary. Okay.
Then goes across the mitral valve into the left.
Sorry, I'm going to play a little bit of a video.
Most of the work in terms of delivery of blood to the body. That blood cell is now ejected into the aorta to some organ or muscle or skin in the human body.
So the very first part of today, so heart disease is really complicated to explain just in person. I think diagrams can really be helpful. And before we try to learn anything about an abnormal heart, it's good to know what normal is, because the heart is very complicated. There are 4 chambers that make up the heart with 4 different valves. So I wanted to share a quick video just going over what is the normal function of a heart, what does that look like, and then we're going to talk a little bit more about dilated cardiomyopathy, and then we're going to get into the specifics of why are we worried about grain-free particularly in regards to cardiomyopathy. So this is a human heart, but it is very similar to a canine heart.
The normal heart has two sides, the right side and the left side, and four chambers, the top receiving chambers, or atrium, and the lower chambers, which are thick-walled pumping chambers, called ventricles. Red blood cell will come from either the superior vena cava or the inferior vena cava and enter into the right atrium. The blood then flows across the tricuspid valve to the right ventricle. The right ventricle then squeezes and ejects that blood cell into a vessel called the pulmonary artery. Pulmonary artery splits into two vessels, each going to the lungs. As that red blood cell makes its way through the lung, it returns through the pulmonary veins to the left atrium. That blood is now oxygenated. It's picked up oxygen, then goes across the mitral valve into the left ventricle, which does most of the work in terms of delivery of blood flow to the body. That blood cell is now ejected into the aorta to some organ or muscle or skin in the human body.
And that left ventricle is going to be one of the biggest things that we're going to be talking about as we talk about dilated cardiomyopathy. So that gives you kind of a visual of what normal blood flow looks like, because the next video that we're actually going to show is talking about an abnormal heart that has dilated cardiomyopathy. And it really uses a really good analogy of traffic to help explain why this disease is so problematic and how much strain it puts on the body. And then we'll go through some of the specifics in more detail.
DCM, or dilated cardiomyopathy. Do you hear those regular noises? That is Idle's heartbeat. There, you see? But let's look a little more closely at how it works. Normal blood circulation involves several stages. The blood, our cars in this case, arrives at the heart and builds up in the atrium, a sort of antechamber, sealed off by a door or valve. When these valves open, the blood flows into the ventricle, another cavity, where it will be put under pressure to be sent through the circulation. The doors are perfectly tight and the blood can only move in one direction. This dense, very orderly traffic transports oxygen, water, and nutrients. The number of vehicles in circulation depends on the body's needs. And it works like that at each heartbeat. In the case of DCM, or dilated cardiomyopathy, the ventricle gradually dilates and loses power. The muscle becomes finer and finer. The ventricle contracts less intensely and the blood is pumped out with less force. With time, some of the cars don't have time to get out and circulate, and others remain blocked in the atrium, waiting their turn. Poor Idle suffers the consequences as his heart beats more and more quickly. There are no longer enough cars, so not enough supply of oxygen and nutrients for the whole of the body and its organs. It just runs out of gas.
Syncope means fainting.
The valve between the atrium and the ventricle ends up failing, leaving a nice wide opening for the disoriented vehicles to pass through. This causes a traffic jam in the atrium. There are now fewer cars going in the right direction, and we talk about lower blood flow. The traffic jam that forms upstream makes circulation difficult. To ease the traffic, the trucks are taken to one side to empty their water tanks into the lungs. This is what is referred to as pulmonary edema, which causes a cough that is not necessarily very loud, but is repetitive. This will then be followed by other symptoms.
Okay. All right. We'll get back into our PowerPoint. It hates every time I log out. Just go down? Okay. All right. So that's a little bit of a short explanation of what dilated cardiomyopathy looks like. So when we have dilated cardiomyopathy, the muscle contractility, so that ability to contract and push the blood out into circulation, and it gets really large. And what happens is the blood backs up because it's not being pushed up as it should, and it leads to a lot of problems. So things that you'll see as a pet owner are as small as things like just a change or maybe a decrease or loss in appetite. Sometimes you can see pale gums because that blood isn't getting to the tissues like it should because the heart can't physically pump hard enough. We can see that they start breathing harder and harder. That especially happens when we start to see fluid that's building up in the lungs because the heart's not working very well. Coughing, just like the video went over. They can have exercise intolerance, and it can be pretty subtle, especially in the early stages. You know, maybe a dog that usually goes on a 2-mile hike, at the end of that hike is kind of lagging back and just not out in front like they normally are. You can even see weakness where they'll have a harder time kind of getting their feet underneath them and getting steady. And then fainting or syncope as well. So how do we diagnose dilated cardiomyopathy? So one of the very first things that we do is when we're doing our physical exam, we're listening to the heart, and we're also feeling for pulses, so making sure that the pulse is strong and even. When we listen to the heart, we can hear what is called a heart murmur or an arrhythmia, so an irregularity or a swoosh, instead of just hearing that lub-dub, lub-dub. As the heart's pumping. So once we start to see these types of changes, especially in specific dogs, and we'll go over the specifics of who we worry a little bit more about, one of the very next things that we'll do is hook them up to what's called an ECG or an electrocardiogram. And this measures our heart waves. And we can see arrhythmias, so we can see elevated heart rates or even things like VPCs or a preventricular contraction, which is right here. So this kind of wide, really bizarre looking one that doesn't match any of the others. And then we go, uh-oh, what's going on with this heart? We need to look at this heart more. And then typically, we'll even take things like x-rays or radiographs of the chest. And it's a little bit fuzzy, but when you look at this x-ray, you see that the heart starts to get really round, and it'll be much bigger than a typical heart. And every dog's heart is a little bit different shaped, so we actually do measurements of the heart and compare it for their breed to see what is normal and what is abnormal. And then particularly in some breeds, I'm particularly going to pick on my Dobermans. One of the things that we'll see if we don't see any changes here, but we're hearing an arrhythmia. So the ECG, when we're looking at it, looks normal, and their heart looks okay, but there's still a breed we're really worried about dilated cardiomyopathy. We'll actually have them wear a vest, which is called a Holter monitor, that measures a whole day's worth of an ECG and look for these types of changes, because in the very early stages of disease, these happen very rarely. So sometimes we miss them when we're doing just a. And then finally, if we have enough suspicion that this is a problem and we have an enlarged heart, we're actually going to confirm that with what's called an echocardiogram, where we ultrasound the heart. And this is a really classic picture of a echocardiogram. So with this echocardiogram, there are two dark circles. The top dark circle is the left ventricle, and the bottom dark circle is the left atrium. They're really big, and the walls of the heart muscle are very, very thin. And that is classic for dilated cardiomyopathy. Okay, so how do we treat dilated cardiomyopathy? No case of cardiomyopathy is treated exactly like the one before it. Every recommendation that we make is based on the severity of your pet's disease. And typically we start with medications, so we can use medications like diuretics, so similar to a water pill where it drains excess fluid out of particularly the lungs is one of the biggest things that we worry about. We can use things like ACE inhibitors, so enalapril or things like that, and that helps to relax the blood vessels so the heart doesn't pump so hard trying to get the blood to move in a forward direction. And then we can use medications like this top one, which is called vetmedin, and that helps the heart pump more efficiently. So it helps with those contractions or the pumping part of the heart. Okay. This is the scary part about this disease. So this disease is very rarely reversible. Caveat to that, one of the things that we're seeing with our very early dilated cardiomyopathy dogs that are associated with diets, these dogs are doing well when we catch it early. And they can have normal life expectancies. And you can kind of see over on our little graph on the side that shows the percentage of dogs, and then on the bottom part is the number of days that they survive following diagnosis. And you can see there's a pretty steady drop, especially right in the early part of the disease, which is why catching it early is so important. Typically, once a dog develops dilated cardiomyopathy and those chambers of the heart stretch, what happens is that they live with this disease for the rest of their life, and we're continuing to monitor their hearts as they age. Once the dog's heart fails, so they develop what is called congestive heart failure. So at this point, the heart can no longer keep up, and it actually goes into a state where more blood is backing up than moving forward. That's called congestive heart failure, and typically what happens is we start to see fluid building up in either the abdomen, which is called ascites, or in the chest, which is called pulmonary edema. And these can look very different. So this gets scarier because we have to get that heart out of failure and functioning more normally to improve that dog's quality of life. Dobermans, unfortunately, I'm sorry to pick on my Dobies, I love them. They do have a poorer prognosis. And getting them started on treatment and how they respond to treatment early in disease has been shown to have a better prognosis, which is also great. So why do we care? So this is a disease, like I said, I keep picking on my Dobies. This is a disease we worry more about in specific breeds, but why is this a big deal, especially right now? So the FDA has received reports for 560 dogs that are affected by dilated cardiomyopathy, and these are all associated with grain-free diets. Of those 560 dogs, 119 unfortunately have succumbed to their illness and passed away. That's a really large percentage of dogs with dilated cardiomyopathy that are dying because of their disease. So we need to figure out why this is happening. So this actually led to an FDA investigation of grain-free diets to figure out why is this happening. Investigation has been moving forward, and I'll go over those few pieces with you. And the biggest concern too is that the breeds that are being affected are not the normal breeds that we think about getting cardiomyopathy. So like Indy is a Bernedoodle. She's not supposed to get cardiomyopathy. That's a disease of Dobermans, of Great Danes, of Irish Wolfhounds, and Spaniels. It just doesn't make sense that these dogs are getting cardiomyopathy, so that raised their suspicion as well that there was a problem. And one of the things that's concerning to me as well is that it's not just grain-free. It's happening in other diets as well. So they've created an acronym that's called BEG. So it means boutique, exotic, or grain-free. So the boutique is some of our smaller companies that are doing some of the high-end diets and things that have human-grade ingredients and things. Our exotic proteins are proteins that are alligator or zebra or really crazy things like this that are not things that typically we historically think of dogs eating. And then finally, I think everyone feels pretty comfortable with what is and isn't, grain-free. So really interesting as we're getting more information as this investigation's moving forward. In 2018, that's when they first started publishing some numbers, and they actually just released an update at the end of June this year. So this is within the last almost month, kind of the latest and greatest. And this is just a report of, you can see in 2014 through 17, very few cases of DCM reported to the FDA, but then we saw a big spike in 2018, and then we're still seeing quite a big spike, and this is only through April. So from January to April, we saw 197 reports. And I think a lot of that is awareness. So owners like you that are educating yourself on what is the very best that we can be doing for our pets, because it's hard. We all want the best for our pets, and we're doing the very best we can with the information that we have. Okay. So what causes DCM? Kind of breaking this back one step, because we don't want to, there are other things other than diet that can cause DCM. One of the most common things that we've seen related to DCM is genetics. So this is an inherited gene in a number of breeds. Again, I'm sorry, Dobies, I'm picking on you, but my Dobies, my Boxers, St. Bernards, Newfies, those types of big guys, typically a large or giant breed dog disease. Our little Cocker and English Springer Spaniels break the mold. There are little dogs that do tend to get DCM. In the 90s, there was actually a really big spike of DCM in kitties. So DCM in kitties is not common at all. Our kitties get a totally different type of heart disease, but they actually found in those kitties it was related to a vitamin deficiency, so taurine. And then in 2018, that's when the FDA announced that they started investigating reports of dilated cardiomyopathy in dogs eating certain foods. The hard part with this disease, though, is we don't know exactly why some dogs get this disease. There are some dogs that have no known cause. Okay. So as I was at my national convention this weekend, I went to the FDA's update where they told us a little bit about what they've been finding as they're gathering information and talking to pet owners. They don't have all the answers yet, and that's okay. They're going to work on it. But there are a few things that they found. So they have a few concerns. They found that a number of dog food breeds are more represented, and these diets tend to have a lot of legumes in them. So we tend to see these replacing grains, like our chickpeas and things like that, replacing grains. They tend to have very exotic ingredients that are not traditionally fed to our pets. Again, I think about those weird proteins like kangaroo and we see even stranger things as well. The other thing that they've had some concerns with is the lack of quality control of certain ingredients going into some of these foods. So especially some of our smaller companies, they don't have the same quality assurance regulations companies have. So one bag of food is not necessarily exactly same as the last same brand, same flavoring. It may not be exactly the same. And then the variability that's happening across diets as well. They had originally thought that it was associated with low taurine levels. In some dogs it is, and those dogs get taurine and their heart disease starts to improve, but they found that a large that are eating grain-free diets have normal taurine levels. And that adds a little bit of a conundrum because, okay, why is this happening then? And that's the area that they're still researching. But it tells us that even if we're feeding one of these diets, if we're supplementing taurine, that may not be enough. Your pet may still be at risk for developing cardiomyopathy. One thing they are looking into is the bioavailability, so the ability of the body to actually use that taurine. It's there and it's in large enough amounts, but can the body use it? And then deficiencies of another nutrient or even toxicity from other nutrients is another area where they're currently researching to try to see if that could potentially be a cause. Come join us. Yeah, come join us.
Am I late? I thought it was early.
Oh, you're okay. All right. Just a little bit of information of some of those other types of food that have been reported to also have cases of dilated cardiomyopathy. Unfortunately, our raw and our homemade diets are also having reported cases. So we have to be really cautious. I have a lot of owners that prefer to do home-cooked meals or pets that truly only tolerate specific ingredients. And that's when I really rely on my veterinary nutritionists for their help to make sure that we're providing a very well-balanced diet for these dogs. And it's really quite easy to do. They have a website which is listed here. You can go online and search for a diplomat. So this is a veterinarian that has specialized training in veterinary nutrition. And unfortunately, Utah does not have a veterinary nutritionist, but pretty much every state around us does. And a lot of veterinary nutritionists also allow you to do phone consultations. So you can actually chat with them about your wishes, your concerns for your pet's diet, and they will help you to formulate a complete and balanced diet if you are looking to do things like home cooking. And so you just really have to be a little bit cautious because, again, working under the directions of a nutritionist, because every ingredient that we get is not always the same, and we want to make sure that we're providing something that's very well balanced at each individual meal. So individual ingredients become very important with home cooking diets. All right, that was tons and tons of information. Before we kind of get into the specific recommendations for each pet and each different scenario of grain-free, what questions do you guys have on the disease itself or the research that's being done by the FDA right now? Yeah.
How significant is the data that you're using with such small number of dogs compared to how many dogs there are in the country?
And that's the hard part right now, and I'm hoping as we raise awareness, we're going to get a larger population of dogs, because there is such a thing as population bias, you know, when you have such a small percentage of dogs. But I think it is significant, and the reasons I do think it's significant is because so many of breeds that are not traditionally being known to have this disease are developing this disease. So that's what really made the FDA step back and say, this is a problem. We need to find out why. And we're not there yet. We don't know the why, but they're starting to piece some things together and to focus that investigation. Good question. Thank you for that. Yeah.
On the slide that had the graph and the FDA, the foods, I can't see those.
Oh, yeah.
Can you name
Okay.
some of those foods?
So there's quite a few breeds in here, and I don't mean to offend any company. This is just, like I said, from the FDA's research. So Canna, Signature, Taste of the Wild, 4Health, Earthborn, Blue Buffalo, Nature's Domain, From, Merrick, California Natural Balance, Origin, Nature's Variety, Nutrisource, Nutro, and Rachel Ray Nutrish. Those were the top ones that they found related to this disease. And just like you said, that is a selection bias of that specific group of dogs. I know a number of dogs that are eating these foods and having no problems, but I think that's the big question right now is, you know, how much of our dog population is actually affected and how much is subclinical, so affected, but we don't know it because they're not showing signs yet. That's the scary one to me. Okay. Thank you for that question. Sorry about that.
On the next chart.
Yeah. Oh, so this talks about different types of dog food formulations, and it goes over what types of food have had cases. So the majority were dry kibbles. There were a few that were feeding multiple forms, so a mixture of dry and wet. We also have a few that they didn't report what form they were feeding. They just said they were feeding this diet. Raw, there were 9 cases, and then there was 1 home-cooked diet, 1 refrigerated, 1 semi-soft, and 1 tubbed. So these are just the formulations of the food. And the reason I put that on there was for our folks that do home cook and do raw. I think that, again, you know, do these things safely, but I think we just need to be really cautious and know limitations. Okay. These are great questions. Anyone else? Yeah.
Well, my sister-in-law in Evanston has been panicked about this. Her question was, I guess she read something about the taurine levels, but it sounds like that's not confirmed, or it can go either way.
So, and we'll talk about that as we talk about pets that are eating grain-free. So the question was in regards to what's going on with taurine in these grain-free dogs, because we know taurine deficiency can lead to DCM. In some dogs, it is a true taurine deficiency. They're not getting enough of taurine in their food, so they are developing disease. You give them extra taurine as a supplement and switch their food, and these dogs do really well. Their heart disease begins to respond, and they start to get back to their normal selves. But they're finding a very large percentage of dogs that have normal taurine levels. So that's why they said, okay, we don't exactly have it yet. We don't know why this is happening. It's part of their kind of algorithm of why they think this might be happening in some dogs, but there's no blanket cause yet. I think it's very open to interpretation, and there are different causes for different dogs too. So it's very complex. All right. Anyone else? Okay. So now we're going to go over a few specific scenarios because this is a question that I get a lot, because we have a lot of owners that see the FDA investigation and they say, oh my gosh, my dog's been eating grain-free. And this is the conversation, Shawnee, that you and I had when this happened. So what do we do? We've been eating grain-free. Sometimes it's for a very long time. Like my second case that I diagnosed, he had been eating grain-free for 9 years. 9 years. But as he aged, we began to see that his dilated cardiomyopathy became clinical. So for these, I do consider transitioning away from a bag diet to a diet that is compatible for that dog's life stage, for their exercise requirements, and then any other medical conditions. And that recommendation varies for every pet. I have a few brands that I do like because they do a lot of veterinary research to tell us, you know, their diets are nutritionally sound. But again, it's a very individualized conversation that I have with a pet owner to talk about their wants as well. And I always look for AAFCO label. So this is the American Association of Feed Control Officials. These are the regulatory body for pet food. I want to see a nice stamp that says AAFCO on the label to know that this diet has been studied either by diet trial or nutritional analysis to be appropriate for that specific life stage that it's marketed to. That's really, really important. If you look at any bag of food, it should have that on it. And it should also be, say on there too, that it should be fed, if it says to be fed as a supplement, that doesn't mean that that's just what we can feed. We can feed that, but we need to have a complete and balanced diet in there as well. And then I always kind of caveat this. When I'm saying my recommendations and things, again, I say a lot of brand names that a lot of people know. We don't get any kickbacks from them. They don't give us anything free. These are just the people that are out there saying, hey, this is what we know about veterinary nutrition, and we want to make sure you know about it too. Signs. So, and if you see anything, we want you to see your veterinarian right away, even if it's just something very subtle, because a lot of these in the very early stages, they're very hard to pick up because the dog's just not acting sick, but just not right, just a little off. And then a lot of times we'll run blood taurine levels, so we'll send out taurine levels to see if we have a deficiency. A lot of times too, some veterinarians will elect to do a test that is called a pro-BNP. So this is a marker for increased stretch or stress of the heart muscle. And if this value is elevated, then we know we need to look for heart disease. Or we can skip all of these things and go straight to echocardiogram, because that's the gold standard for diagnosing heart disease in dogs. So we can go straight to ultrasounding the heart, and that's what we did for Indy. And it was the best decision we ever made, wasn't it? Any questions on any of these recommendations? And these are simple things. They're tests that can be done in the hospital. We typically get a result in just a few days. Yeah.
Going back to the thing with the food.
Yeah.
And any dogs that have been on any prescription foods that have come down with this heart failure?
Not in the foods that I have seen reported. So if they are, it's in a low enough level that they're not publishing it, but not in the list of foods that I've seen. But they're only putting their top percentages. It's not all of them, though. That's not an exclusive list. Mm-hmm. Okay. Any questions? Okay. All right. So this is a scarier one. My dog's been eating grain-free. I realized something was wrong, and we got the diagnosis of DCM, and your heart drops. So what do? We measure taurine levels because we do know those dogs that are taurine deficient will improve with supplementation. We give our heart medications as directed by our veterinary cardiologist, and we monitor. And that monitoring schedule is going to be varied depending on the stage of your dog's heart disease, because just like in people, canine heart disease is staged based on severity. We switch away from our BEG diets, again, to something that's AAFCO approved, appropriate for that life stage and lifestyle. We also talk about the environment. We talk about, are there any other pets in the household? Because who's got more than one dog? How many of your dogs eat the same thing? That's a lot of hands. Are there other dogs in the household that are also affected? And we're going to talk about screening those dogs as well. Unfortunately, not all dogs are going to improve. There's a good percentage, and especially those that we're catching early, that are responding to improvement, but unfortunately, not every dog is going to get better from their disease. My second case, I lost him, despite everything that we tried to do, and we do the very best that we can, but sometimes it's not enough. And no, if we are improving, it will take time. It takes time for the heart to recover. It can take months and months and months of medications and rechecks and things like that. Sometimes we won't see any improvements for almost 6 months. And then we're going to recheck as directed by our cardiologist. But the bottom thing is the most important to me. Do not feel guilty. This is not your fault. You didn't know. We didn't know. We didn't know this was a problem until the FDA started this investigation. And I think this is something, as pet owners, we need to give ourselves a break, because it's really hard to try to do the very best for your dog and for something like this to happen, because nutrition is difficult, and every dog is so unique in what they need and what their tummy tolerates and things. So the last thing on there is one of the very most important to me is do not feel guilty about this. We are going to do everything we can to try to get your pet back to 100%, but this is not your fault. Any questions, sorry, about this? Yeah?
I was just wondering if we use grains, what are the best
The good thing with dogs is many dogs don't care. A lot of dogs will tolerate every grain pretty similarly. They break it down into their carbohydrates and use it as energy. So typically anytime I'm transitioning to a new diet, I'm doing it slowly. And I'm switching them over 10 to 14 days just to give their stomach some time to adjust to that new food. Even kind of our grains that are considered filler in lots of things, dogs do a great job of using as energy, like corn. Corn gets a bad rap. But corn has a lot of energy in it, especially when it's in a lot of its different formulations and things. Shoot, cattle have been eating grain forever and they grow like crazy. That's my background. I grew up on a cattle farm. So there's a lot of really good grains out there, but again, I think kind of finding that combination of protein and carbohydrates and fats for each individual dog, that's the more important part to me. I'm not so keyed in on the ingredients, but the percentages of those important nutrients. Does that make sense?
It does, and it's really hard
Yeah.
when your dog already has other issues,
Yeah.
like liver disease and gallbladder.
Yeah.
So
And
I need a veterinary nutrition.
yeah, those are tough. Those are the ones, that's when we say, okay, let's link up with, you know, the gurus out at UC Davis and things and talk to them and find out what's the very best thing we can do, because it's tough. It's hard with dogs that, and especially like I think of my Luca back there that's got a super sensitive tummy, like feeding her different things can be really challenging and her GI tract just doesn't tolerate it. So that's where I think those folks are wonderful, because they have a lot of specialized training in developing specific things for your pet, because no two pet has the same nutritional requirements. Yeah, of course.
So, and obviously I've been dealing with this.
Yeah.
There's a lot of research.
This is Shawnee, Indy's mom.
There's a lot of individuals, and I'm part of a lot of companies that choose to follow the SAMA guidelines. What's your thoughts on that? Because none of those foods have been implicated, even in the group setting, they're not being implicated.
And the hard part is we only know what we know from this investigation right now, and it is a small proponent of dogs. So these are the foods right now that I'm saying I know that these are ones that I'm worried about, so I'm transitioning away. But that's me being a very cautious human being and saying I just don't want to take any risks. Knowing that there may be foods on that list that are affecting dogs that we don't know about yet. So if you have concerns, or we have a dog with potential clinical signs and then we get a diagnosis of DCM, we need to report it. There's a reporting process for owners and a reporting process for veterinarians to submit their cases to the FDA to add to our knowledge base so we learn more about what's happening with these foods in our dogs. Any other questions? Okay. All right. I know I got probably a few kitties out here. Who's got kitties? All right. We got a lot of kitties. All right. I had to throw in a little bit of information. So we've been talking a lot about dogs, and the FDA report talks mostly about dogs as well, but they do have a little bit of information that's coming out in the cat world as well. Because unfortunately, kitties are not small dogs. They're little tiny aliens that run around and live in our houses as well. But this is affecting them as well. So they've seen 14 reports of DCM in cats since this investigation has started. Unfortunately, 5 of those have resulted in fatalities, so cats that have passed away from their disease. Currently, the recommendations are very similar to dogs. They're seeing, especially in cats, taurine is a bigger deal in cats than it is in dogs, so measuring taurine levels in cats is something that's more recommended. They are recommending it in dogs as well, but something that we see more substantially in our cat population. Okay. This is just a little bit of information, so I have quite a few references on here. I'm going to point out the one that's the most so the most recent is this FDA investigation and the June 27, 2019. That's the latest report that they've put out. It's about 14 pages long. I tried to pick out the kind of top pieces of it today, but it's a really interesting article if you really feel like getting a nice cup of coffee and having a good read. But I'm excited to see what their investigation entails, and our goal is to continue to provide you with updates as we get more information. And if you have any questions, I'm going to stay after the session for a little bit. Dr. Verona's in the audience as well. I know she'd be happy to answer any questions. But we're going to get through this. We're going to figure it out, and we'll do it together. Yeah. So thank you all. Any final questions on dilated cardiomyopathy and grain-free diets? Yeah.
Forgive my ignorance, but obviously dogs are descendant from wolves and all of those who were on, meat-only diets. Do we have any idea why the meat-only diets are no longer working? Are they evolving into animals that eat grains, or?
And the hard part is as we kind of trace that lineage and things, so much has happened between wolf to dog, that the dog has adapted to eating grains and using grains. We don't know exactly why these now primarily meat, and they're not as concerned about the fact that it's meat. They're worried that it's a lot of things that dogs aren't used to eating, like weird meats. Stuff that a dog would not eat in the wild. Like, what dog is eating an alligator? I don't know any dogs that eat alligators. Kangaroos and things like that. They're just like, so those exotic things. And then the chickpeas and those types, the lentils, those are the things that dogs aren't traditionally known to be eating. So I think that's more the concern right there, is it's not so much the meat issue, it's those things that dogs haven't really been eating these in the past, and now we're feeding them this because it's very common in human kind of food fads, I'm going to say, because I can't think of a better word than that right now. Like, I've done paleo, like I hit the CrossFit train and did that for a long time and went paleo and ate like a caveman and things like that, but like Gibson doesn't, he lives on my couch and he's a couch potato. So I think a lot of it is that they're eating things that are outside of what we've traditionally ever fed a dog. And that's the part that they're trying to piece out. What about those things is it? And we don't know yet. Yeah.
Talking about cats, I read the FDA info.
Yeah.
And they talked about the legumes, and they talked about peas.
Yeah.
And my cats eat duck and pea. I mean, are peas going to be a problem?
So if you're feeding an AVCO-specific label and we're seeing other things, so it's not just those things, so a lot of those diets that do have some of these ingredients that are a little bit more worrisome, the ingredient is far down the list. So when we're looking at a pet food label, they start with the ingredient that is the food has the most of, and then it goes down from there, and then they go to lower quantities. So we really are worrying when those peas and things like that are in that top 5 things in the food label. And if they are, that's when I'm starting to think about a switch, because that tells me a pretty large part of that diet has something that you wouldn't traditionally think of a dog or a cat eating. Yeah. And then the caveat of that is if your dog or cat has a nutritional requirement to eat those things because of allergies or something like that, that's when I'm going to lean on my nutritionist and say, hey, what else could we do for this specific animal?
Yeah, because that's why we switched him
Yeah.
a few years ago, was because they thought he had a food allergy.
Yeah. And that's really common. So food allergies are very common. Inflammatory bowel disease, I think, is very underdiagnosed in our canine and feline patients as well. So I think that's tough, and it's a very delicate balance. And I think we're going to learn new things about this disease particularly, and nutrition over the next months to years as they get more information and they do more studies. Okay. Wonderful. All right. Any final questions? Okay. Oh, yeah.
Would you be willing to shout out the brands that you're...
Oh, yeah. So, okay. I call them my big 5. So the ones that I kind of think of when I'm recommending, and these are brands, these aren't specifically foods. Every food, I kind of have particular things that I have the most experience in within these. So I love Hills. I think they do a really great job of advancing veterinary nutrition and providing a really good diet. And their diets are all tested on feeding trials, which is the gold standard for analyzing foods. Purina is also a brand that I love and I trust. Iams, Eukanuba, and Royal Canin. Those are kind of my top 5 that I think about, and every recommendation within kind of those 5 is, like I said, very different. And I have some dogs that, we try one thing and they tolerate it not quite as well as we hope, so we switch to something different. And it's a little bit of trial and error within those 5, but I can usually find something I like, and the dog likes too. So Iams, Purina, Royal Canin, Eukanuba, and Hills. Yeah, sorry, the first. Okay. Yeah.
Did you say blue?
So did I say blue for my top 5? I did not, no. Unfortunately, Blue Buffalo has fallen into kind of this criteria of, I'm a little cautious with Blue Buffalo right now. They are advancing some of their lines of food, so they do have a veterinary line that is analyzed by nutrition analysis and feeding trials. So those diets within Blue I would be comfortable talking about and potentially recommending, but their exotic protein and their grain-frees I would no longer consider feeding for typically my patients. Yeah. And I don't mean to hate on any brands or anything like that, but just like I said, I'm a cautious person by nature, so I'm going to go with what the latest literature tells me. Okay. And I'll be here afterwards if there's something. Oh, do you have a question online?
I have a Facebook question.
Okay. Guys, I love this. The questions are fantastic tonight.
Would like you to break down really quick the symptoms, just like at home, to pay attention for, to see if owners what they should look out for.
Okay, perfect. Doot, doot, doot. Okay, so this is a little dog that has ascites or fluid in his belly. You can see his little pendulous or pot-bellied appearance. So one of the biggest ones that we tend to see in dogs with heart disease is a change in appetite. It doesn't have to necessarily be a loss, but it could be a decrease in appetite. We can see a pale color to the gums. Typically, they should be a nice, healthy, light pink, but they'll get almost whitish in color when the heart's not pumping well. We can see that they're really breathing, and this is what Indy was doing. And it wasn't real obvious. She wasn't struggling to breathe. She was just panting more than she traditionally did. So she'd be at home resting, and she'd be panting. And that's not something that she normally did. We can see coughing. This is common when dogs get fluid within their lung tissue when the heart starts to go into that failure state. We can see where they're exercise intolerant, so dogs that, and it can be very subtle as well. A dog not out in front on a walk is behind you, or a dog that usually runs to go out to the mailbox just wants to sit and wait for you on the step. Those types of things are pretty common. And then fainting is another one when the heart really starts to have a hard time getting blood to the tissues, so fainting or syncope. All right. I'll just put this one back up just in case anybody wanted these references. All right. I'll stick around afterwards. So we are back next month. I am still confirming my speaker, so I will post on our Facebook page once I have a definitive topic. But we are going to actually skip the first Tuesday in September because that's right after Labor Day. So we're going to do the second Tuesday in September. And then there's more food and back, so if you'd like any food before you go home, please feel free to take some. There's also veterinary staff along the back of the building if you have any questions or you just want to say hi. And then, like I said, I'll be up here if anyone has any questions or things for me. Oh, yeah.
Can I make a suggestion on a topic?
Please. Oh, and always, I want to hear your topics. So I coordinate the seminars every month. So please tell me if you have any topics that you'd like to hear.
I mean, I don't know if it'll take an hour. I just think there's a lot going on about algae
Oh, good.
in water. And my dogs are in the water all the time. And there's a lot in the news and on Facebook about algae and what to look for and what bad algae looks like.
And I told Shawnee I am going to try to get a little bit of info on reported cases in Utah and things and post them on our Facebook just so people know where algae is and if it's happening around us. So I'm going to reach out to some of the local ERs and our state veterinarian to see how things are looking. I think that's a great topic though. Toxicity is a really fun one to talk about. Okay. And if anybody else has any other topics, I could talk nerdy medicine all day. Okay. Thank you all. Thank you. Thanks. Thank you so much.
No, along with that water.